Cognitive behavioral therapy explained simply. Cognitive behavioral therapy, or CBT, is one of the most widely researched and effective approaches in modern psychology. At its heart, CBT is based on a simple but powerful idea. Our thoughts, feelings, and behaviors are deeply interconnected. What we think influences how we feel, and how we feel shapes what we do. By changing the way we think and act, we can change the way we feel. That principle sounds straightforward, yet its applications can transform lives. Do you understand CBT? Let's start with the basics. Imagine you are walking down the street and you see a friend across the road. You wave, but your friend doesn't wave back. Immediately, your mind generates a thought. She must be mad at me. That thought leads to a feeling, sadness, maybe even anxiety. That feeling then guides your behavior. Perhaps you avoid reaching out to her later, or you replay the situation all day, feeling rejected. Now imagine an alternative thought. She probably didn't see me. That thought leads to a different feeling, a neutrality, maybe even understanding. The behavior changes too. You might still text her later to say hello. The same event, two different interpretations, two very different emotional outcomes. CBT focuses on these interpretations. It asks us to examine the thoughts that arise automatically, often without our awareness, and test whether they are accurate, helpful, or distorted. Psychologists call these automatic thoughts. They are the quick, habitual interpretations we make throughout the day. Some are harmless, but others can spiral into patterns of depression, anxiety, or self-criticism. CBT teaches us to slow down, identify these automatic thoughts, and evaluate them. One of the core tools of CBT is the thought record. It's a structured way to capture a situation, the thoughts it triggered, the feelings that followed, and the behavior that resulted. Then, we analyze those thoughts. Are they factual, or are they assumptions? Do they contain common distortions like catastrophizing, black and white thinking, or overgeneralization? By writing them down, we pull thoughts out of the shadows of the mind and onto paper, where they can be inspected objectively. Consider a common distortion, catastrophizing. This is the mental habit of assuming the worst possible outcome. For example, you make a small mistake at work and immediately think, I'm going to get fired. CBT challenges you to ask, what is the actual evidence for this? How many times have I made small mistakes and been forgiven? Is there another explanation? Through this questioning, we see that the catastrophic thought is an exaggeration, not reality. Another distortion is all or nothing thinking. This is the habit of seeing things in extremes, perfect or terrible, success or failure, good or bad. Imagine someone studying for an exam. If they don't get 100%, they feel like a complete failure. CBT introduces the concept of continued thinking. Instead of labeling performance as total success or failure, we learn to rate it along a spectrum. Scoring 85% on an exam may not be perfect, but it is far from failure. That shift in thinking changes how we feel and behave. CBT is not just about thinking, though. It also pays close attention to behavior. The behavioral part of CBT emphasizes that our actions can maintain or worsen emotional struggles. For instance, in anxiety, a common behavior is avoidance. A person afraid of social situations might avoid parties, meetings, or even phone calls. Avoidance gives short-term relief, but long-term it reinforces the fear. CBT helps people break this cycle by encouraging behavioral experiments or gradual exposure. Step by step, they face what they fear, testing whether the catastrophic predictions actually happen. Over time, the brain learns new associations. I went to the gathering. Nothing terrible happened. I survived. This breaks the cycle of avoidance and fear. Another behavioral concept is activation, particularly useful for depression. When people are depressed, they often lose motivation and withdraw from activities. Ironically, that withdrawal deepens the depression, creating a vicious circle. CBT uses behavioral activation to interrupt that loop. The idea is simple. Plan and schedule small, meaningful activities even if motivation is low, and gradually increase engagement with life. These activities, whether a short walk, a call to a friend, or cooking a simple meal, provide small doses of positive reinforcement that can help lift mood. The beauty of CBT lies in its practicality. It is structured, goal-oriented, and usually time-limited, often running 10-20 sessions. Each session has an agenda, and between sessions, clients practice skills as homework. This makes therapy active and collaborative. Therapist and client are partners in problem solving. The therapist is not a distant authority handing down wisdom, but a guide helping the client test ideas, challenge thoughts, and practice behaviors. CBT is also adaptable. It has been tailored to treat a wide range of issues: depression, anxiety disorders, obsessive-compulsive disorder, post-traumatic stress, insomnia, eating disorders, chronic pain, and more. Its flexibility comes from the universal principle that thoughts, emotions, and behaviors interact, regardless of the specific problem. For example, in panic disorder, people often misinterpret normal bodily sensations like a racing heart as signs of impending doom. CBT helps them learn that these sensations are uncomfortable but not dangerous. By reframing the interpretation, the fear diminishes. In insomnia, CBT targets the unhelpful beliefs and behaviors that interfere with sleep, such as if I don't fall asleep immediately, I'll be useless tomorrow. By challenging such beliefs and restructuring bedtime routines, sleep often improves dramatically. One might ask, if CBT is so effective, why doesn't everyone use it? The reality is that CBT requires effort. It is not a passive treatment where change happens magically. It demands that individuals practice skills daily, monitor their thoughts, and push themselves into uncomfortable but growth-producing experiences. For some, this level of work can feel daunting, but for those who commit, the results are often life-changing. The science behind CBT is robust. Decades of randomized controlled trials show its effectiveness across cultures and conditions. Brain imaging studies reveal that CBT can change patterns of neural activity, particularly in areas related to fear and emotion regulation. In other words, CBT not only changes the mind, but also rewires the brain. This makes sense, because by practicing new thoughts and behaviors, we strengthen new neural pathways, gradually replacing the old ones. Another strength of CBT is its transparency. Unlike some therapies that are more abstract or open-ended, CBT gives clients a clear framework and set of tools. They can see their progress, track changes in thought patterns, and measure improvements in mood or behavior. This clarity makes CBT especially empowering. Clients often leave therapy not only with relief from their immediate struggles, but also with a toolkit they can use for life's future challenges. Still, CBT is not a cure-all. It may not work equally well for everyone. Some people need deeper exploration of past traumas, which CBT touches on less directly. Others may require medication alongside therapy, particularly for severe depression or certain psychiatric conditions. But even in these cases, CBT often complements other treatments, providing skills that medication alone cannot offer. To bring this down to a very practical level, let's walk through a sample exercise. Imagine you are preparing for a job interview and feel intense anxiety. Your automatic thought is, I'm going to embarrass myself and fail. Write that down. Next, rate how strongly you believe it on a scale of 0 to 1, or let's say 85. Then ask, what evidence supports this thought? What evidence contradicts it? Supporting evidence: I sometimes stumble when nervous. Contradicting evidence: I have succeeded in other interviews. I prepared for this one. Now reframe the thought: I may feel nervous, but I am prepared, and even if I stumble, I can recover. Rate your belief in this new thought. Perhaps 60, then 70 with practice. Notice how the anxiety begins to shift. Exercises like this seem simple, yet repeated over time, they reshape mental habits. The mind learns that automatic catastrophic thoughts are not the only possible narrative. Options exist. Flexibility grows. It's worth noting that CBT is also increasingly accessible beyond the therapy room. Online platforms, self-help books, and mobile apps guide people through CBT exercises. While these cannot fully replace the nuance of a trained therapist, they extend access to people who might otherwise never encounter these skills. Parents and educators are also introducing CBT principles to children and adolescents, teaching them to identify and challenge negative thoughts early in life. These early interventions can prevent the development of entrenched patterns and foster resilience from a young age. Ultimately, the heart of CBT is empowerment. Depression, anxiety, and other conditions often make people feel powerless, trapped by their own minds. CBT hands back the keys. It says, your thoughts are not facts. They can be examined. Your behaviors are not destiny. They can be changed. And through these shifts, Your emotions will follow. That message simple, evidence-based, and hopeful is why CBT remains a cornerstone of modern mental health care. Cognitive behavioral therapy in action. Real-life applications and everyday tools. Cognitive behavioral therapy can feel abstract until we see how it works in everyday life. To bring it down to earth, let's explore real scenarios where CBT principles make a difference, along with practical exercises you can try. These are not theoretical ideals, they are tools tested in clinics, research studies, and countless personal journeys. Think about someone struggling with social anxiety. The automatic thought might be, everyone will think I'm awkward if I go to this gathering. The feeling is fear, and the behavior is avoidance, skipping the event. CBT interrupts this chain. Instead of avoiding, the person identifies the thought, writes it down, and asks, is there evidence that everyone will think I'm awkward? The honest answer is usually no. Then comes a behavioral experiment. Go to the gathering for 10 minutes and observe. More often than not, people are friendly, distracted by their own concerns, or even relieved to connect. The feared catastrophe doesn't happen. Over time, repeating such experiments weakens the anxiety loop. Now let's shift to depression. A common pattern is withdrawal. Someone wakes up and thinks, what's the point? Nothing I do matters. The feeling is hopelessness. The behavior is staying in bed. CBT responds with behavioral activation, scheduling one small, manageable activity, even when motivation is low. It might be taking a shower, walking around the block, or calling a friend. The action sparks a tiny sense of accomplishment, which shifts mood slightly. The new thought emerges. Maybe today isn't entirely wasted. By stacking these small wins. Depression's grip loosens. OCD, or obsessive compulsive disorder, offers another example. A person might have the intrusive thought, if I don't wash my hands 3 times, something terrible will happen. The feeling is anxiety, and the behavior is ritualized washing. CBT's approach, specifically exposure and response prevention (ERP), asks the person to resist the compulsion. They expose themselves to the trigger, touching a doorknob, but prevent the usual ritual. The anxiety spikes at first, but with time, it fades naturally, teaching the brain that the feared outcome doesn't occur. This rewires the fear response. CBT is also powerful for everyday stress, not just clinical disorders. Picture a student about to give a presentation. The thought is, I freeze and humiliate myself. The feeling, nervous dread. The behavior, procrastination or over-preparation. Using CBT, the student challenges the thought. Have I presented before? Did I always freeze? Evidence usually shows at least some past successes. Then comes reframing. I may feel nervous, but I can get through it. By practicing relaxation techniques, deep breathing, grounding, the student enters the presentation with a calmer mindset. The performance goes better than feared, reinforcing confidence for the future. One of the most empowering aspects of CBT is the way it gives people ownership of their progress. Instead of waiting for insight to arrive, clients actively test, record, and reflect. For instance, journaling is not just Dear Diary, writing its structured reflection. A CBT journal might have columns for situation, thought, feeling, evidence for and against, and alternative thought. Over weeks, patterns emerge. Clients notice recurring distortions, like always assuming worst-case scenarios or discounting positive feedback. Awareness alone often reduces their power. Another useful tool is the behavioral experiment log. Here, the client predicts an outcome. Say, if I speak up in the meeting, everyone will think I'm stupid. They rate their prediction at 90%. Then they actually speak up, record what happens, and compare. Often, nothing negative occurs, or someone even agrees with their point. The prediction rating drops next time, maybe to 70, then 50, until the fear becomes manageable. For insomnia, CBT uses a special approach called CBT, or cognitive behavioral therapy for insomnia. It focuses on breaking the cycle of worry and sleeplessness. A person lying awake might think, if I don't fall asleep soon, I'll ruin tomorrow. This thought spikes anxiety, which makes sleep harder. CBTI challenges the thought. Even if I sleep poorly, I've survived before. One bad night won't destroy me. It also changes behaviors. Avoiding screens before bed, keeping a regular schedule, and leaving the bed if awake too long. Over time, these strategies retrain the brain to associate bed with rest instead of frustration. CBT also addresses anger. Someone cut off in traffic might think that driver disrespected me on purpose. The feeling, rage. The behavior, shouting, honking, or dangerous driving. CBT asks, what are other explanations? Maybe the driver was distracted, not malicious, by reframing. The feeling shifts from rage to mild annoyance, and the behavior calm driving avoids escalation. Children can benefit from CBT too. Imagine an anxious child who says, if I raise my hand in class, everyone will laugh at me. With guidance, they test this prediction by asking a simple question in class. When no one laughs, the evidence begins to override the fear. Teaching kids early to spot distorted thinking gives them lifelong resilience. Workplace stress is another fertile ground for CBT. An employee might think, I can never say no to my boss, or I'll get fired. The result is overwork and burnout. CBT helps by challenging the thought, have I ever said no politely? What happened? Often, the boss respected the boundary. The new thought, I can set limits without losing my job, creates healthier behavior. The employee learns to negotiate workload instead of silently drowning. Relationships are deeply influenced by thought patterns. A partner might assume, if they don't text me back immediately, they don't care. The feeling, insecurity. The behavior, sending multiple anxious texts or withdrawing in hurt silence. CBT reframes, maybe they're busy. Their care isn't measured by instant replies. This balanced thought fosters calm, prevents unnecessary conflict, and improves communication. One of the most exciting things about CBT is its evidence across cultures and demographics. Studies show it works in different languages, countries, and even in online formats. It doesn't rely on cultural specifics but on universal human processes, thinking, feeling, behaving. That's why CBT is considered a gold standard therapy worldwide. Some people worry CBT is too surface level, focusing only on thoughts and behaviors without digging into deeper wounds. But CBT doesn't deny the past. It simply asks, how is the past showing up in your thoughts today? For trauma survivors, for example, CBT targets the intrusive thoughts and avoidance behaviors that keep trauma alive. By addressing those patterns, healing begins in the present. Without needing to relive every detail of the past, humor can be a surprising ally in CBT. Therapists sometimes encourage clients to exaggerate their negative thoughts in a playful way. For example, saying, I'm doomed, in a dramatic voice highlights how irrational the thought is, making it easier to release. This technique, called cognitive diffusion, reduces the grip of serious-sounding thoughts. Mindfulness has also been woven into CBT in recent decades. Mindfulness-based CBT teaches clients to notice thoughts without judgment, rather than always challenging them. This is especially helpful for chronic conditions like recurrent depression, where the goal is not to eliminate every negative thought, but to change one's relationship to them. Instead of, I must not think negatively, the practice becomes, there's a negative thought interesting. Let it pass like a cloud. Technology is making CBT more accessible. Mobile apps now guide users through thought records, mood tracking, and relaxation exercises. While these don't replace therapists, they extend CBT principles to people who might never seek formal therapy. The structure of CBT makes it especially suited for digital tools, since exercises are clear and repeatable. The long-term benefit of CBT is skill building. After therapy ends, people carry the tools with them. When new challenges arise, stressful jobs, relationship conflicts, health issues, they already know how to identify thoughts, test them, and act differently. It becomes a self-sustaining process. CBT also emphasizes relapse prevention. Toward the end of therapy, clients prepare for future stresses. They identify triggers, early warning signs, and coping strategies. This proactive approach helps maintain gains long after sessions end. Ultimately, CBT is about freedom. Freedom from being enslaved by automatic thoughts, from cycles of avoidance, from self-criticism that feels like truth. It's about learning that while we can't control every situation, we can influence how we interpret and respond to it. That shift from helplessness to agency is profoundly healing. Deepening the practice of cognitive behavioral therapy. Cognitive behavioral therapy thrives not only in the therapist's office, but also in the details of daily life. The more consistently its principles are applied, the stronger their effect. One of the key practices that deepens CBT is learning to recognize cognitive distortions automatically. At first, identifying distorted thinking requires effort and worksheets. With time, The process becomes second nature, almost like developing an internal radar. When a thought like, "I always fail," arises, the mind starts to automatically question it. Always. Really? What about the successes I've had? This mental shift signals that CBT is taking root. There are more than a dozen common distortions, and each has its own fingerprint. Overgeneralization takes one bad event and applies it to everything. Failing one exam becomes "I'm terrible at" school. Personalization assumes blame where none exists. A colleague is upset and the automatic thought is, "It must be because of me." Filtering focuses only on the negative, receiving 5 compliments and 1 criticism, then obsessing over the criticism. Each distortion has a counter technique. For overgeneralization, remind yourself of exceptions. For personalization, consider alternative causes. For filtering, make a conscious effort to list positives alongside negatives. One advanced CBT exercise is evidence diaries. Instead of focusing only on problems, individuals keep a daily log of evidence that contradicts their negative core beliefs. For someone who believes, "I am unlovable," the diary collects moments of kindness, appreciation, or connection. At first, the mind resists discounting these events as meaningless, but over time, the accumulation of evidence becomes undeniable. The brain learns a new narrative. I may not be perfect, but I am valued. Another technique is behavioral experiments with safety behaviors. Safety behaviors are subtle ways people protect themselves from feared outcomes. For example, someone with social anxiety might speak softly so they avoid drawing attention, or rehearse sentences excessively before speaking. The problem is that safety behaviors prevent the person from discovering they don't actually need them. A behavioral experiment would involve deliberately dropping the safety behavior, speaking at a normal volume without rehearsal, and testing the outcome. Usually, the feared rejection doesn't happen, which teaches the brain it was safe all along. CBT also incorporates problem-solving training. Negative thoughts often flare when people feel stuck or overwhelmed. Problem-solving training teaches a step-by-step method. Define the problem clearly. Brainstorm possible solutions without judgment. Weigh pros and cons. Choose one and test it. Even when the solution is imperfect, the act of structured problem-solving builds confidence and reduces helplessness. In chronic conditions like long-term illness or disability, CBT adapts to focus not on eliminating symptoms, but on improving quality of life. The thoughts might be, "I can't do anything anymore," which leads to despair. CBT reframes, "There are many things I can no longer do, but there are still things I can." Behavior then shifts toward engaging in those remaining activities: reading, connecting with loved ones, creative hobbies. This fosters dignity and purpose despite limitations. Exposure therapy, a branch of CBT, deserves more attention. It works by systematically confronting fears instead of avoiding them. A person terrified of public speaking might create a hierarchy, first practicing a speech alone, then in front of a mirror, then for a trusted friend, and eventually for a group. Each step is repeated until the anxiety decreases before moving up the ladder. Exposure harnesses the brain's natural ability to habituate. Fear declines when the predicted catastrophe doesn't occur. In panic disorder, interoceptive exposure is particularly effective. Clients deliberately induce bodily sensations that mimic panic: spinning in a chair to feel dizzy, running in place to increase heart rate, or breathing through a straw to simulate breathlessness. By experiencing these sensations in a safe environment, they learn that the sensations themselves are not dangerous. This breaks the cycle of interpreting normal body signals as catastrophic. Another advanced concept is schema-level work. While CBT often focuses on surface thoughts, schema therapy, an extension of CBT, addresses deeper core beliefs that originate in childhood. For example, the schema, "I am unworthy," may underlie many daily automatic thoughts. Working at the schema level involves identifying recurring life themes, tracing their origins, and deliberately building healthier alternatives. While this takes longer, it can create profound shifts. Technology-enhanced CBT continues to grow. Virtual reality exposure therapy allows people to confront fears in simulated environments: flying in a plane, speaking in front of an audience, or facing heights. Apps provide daily reminders for thought records, relaxation exercises, and gratitude journaling. The digital format also helps track progress visually, turning improvement into concrete graphs and milestones. Group CBT is another effective format. Sharing experiences with others who face similar struggles normalizes difficulties and provides peer support. Group members challenge each other's distorted thoughts, provide accountability for behavioral experiments, and celebrate progress together. This communal aspect can be especially powerful for people who feel isolated. CBT is also culturally adaptable. Therapists adjust examples, metaphors, and practices to align with cultural values. In collectivist cultures, for instance, reframing might focus on community and family rather than individual achievement. Research shows that CBT remains effective across diverse populations, provided it respects cultural context. One fascinating area is CBT for health anxiety. People with health anxiety often misinterpret minor sensations as signs of serious illness. A headache becomes, "I have a brain tumor." CBT helps by teaching realistic interpretation of bodily signals and reducing checking behaviors like constant Googling of symptoms. Behavioral experiments might include intentionally delaying checking for reassurance and observing that anxiety eventually subsides without catastrophe. For anger management, CBT introduces the anger thermometer. Clients learn to rate their anger on a scale from 1 to 10 at lower levels. Coping strategies like deep breathing, taking a walk, or using humor can diffuse the emotion before it escalates. By tracking triggers and responses, individuals gain mastery over anger instead of being controlled by it. Couples therapy often integrates CBT principles as well. Partners may fall into distorted thinking about each other. If they loved me, they'd know what I want without me asking. CBT encourages replacing mind-reading expectations with clear communication. It also teaches couples to identify and challenge negative assumptions about intent, focusing instead on observable behaviors and constructive dialogue. Mind-body integration strengthens CBT further. Incorporating relaxation training, progressive muscle relaxation, and breathing exercises helps regulate physiological arousal, creating a calmer baseline from which to challenge thoughts. When the body is calmer, the mind is more flexible. This synergy amplifies the impact of cognitive restructuring. A useful metaphor for CBT is gardening. Negative thoughts are like weeds. At first, the garden may feel overrun. CBT teaches us to identify weeds, pull them out, and plant healthier seeds. Behavioral activation is the watering and sunlight consistent actions that nurture growth. With time and effort, the garden shifts from barren or chaotic to balanced and flourishing. Homework remains central to CBT. Without practice between sessions, progress is limited. Homework might involve keeping daily thought records, practicing exposure steps, or scheduling pleasant activities. Therapists emphasize that lapses are not failures but opportunities to learn. Each attempt strengthens new pathways. Research consistently shows that the benefits of CBT last beyond therapy. Relapse rates are lower compared to some other approaches because clients internalize the skills. When future challenges arise, they are equipped to apply the same tools again. CBT is like learning to ride a bicycle. Once mastered, it can be used whenever needed. It's also worth addressing misconceptions. Some believe CBT is about thinking positively. In reality, CBT is not about plastering positivity over pain. It's about thinking realistically, seeing situations clearly, without exaggeration or distortion. Sometimes realistic thinking still acknowledges difficulty, but it also recognizes strengths and options. Another misconception is that CBT ignores emotions. On the contrary, emotions are central. CBT helps people understand how thoughts influence emotions and provides tools to regulate them. Far from dismissing feelings, it validates them while preventing them from dictating destructive behaviors taught in practice. The collaboration between therapist and client resembles teamwork. The therapist provides structure, knowledge, and encouragement, while the client brings lived experience, effort, and experimentation. This partnership builds empowerment and trust. Ultimately, CBT demonstrates that the mind is not a fixed prison. Thoughts are not absolute truths. They are hypotheses to be tested. Behaviors are not chains. They are choices that can be reshaped. The cycle of thought, feeling, behavior can feel rigid, but CBT shows it is flexible. This flexibility is the foundation of resilience. Practical exercises, skills, and daily integration of CBT's strength of cognitive behavioral therapy lies in its practicality. While theory helps us understand why thoughts matter, daily exercises bring the concepts to life. One cornerstone exercise is the thought record, often presented as a table with columns for situation, automatic thought, emotion, evidence for, evidence against, and alternative thought. At first, filling in these records feels mechanical. Over time, they become second nature, teaching the mind to pause, reflect, and reframe instead of reacting impulsively. People often discover that their strongest emotions are linked to thoughts that crumble under scrutiny. Another exercise is behavioral activation scheduling. This means creating a daily plan of activities that provide mastery or pleasure. Depression steals motivation, but action often precedes motivation, not the other way around. By committing to a schedule, even when energy is low, people generate small sparks of accomplishment. Those sparks build momentum. For example, a person might write down 9 o'clock a.m. walk to the corner shop, 2 o'clock p.m. call a friend, 6 o'clock p.m. cook dinner. The activities may seem ordinary, yet each one pushes against withdrawal and reinforces engagement with life. Role-play is another powerful CBT tool. In session, clients might practice conversations they fear having, asking for a raise, setting a boundary, or apologizing. The therapist plays the role of the other person, and together they rehearse possible scenarios. This builds confidence and prepares the client to handle real-life interactions more effectively. Imagery techniques are also common. If someone constantly replays worst-case scenarios, they might practice visualizing a balanced outcome instead. Imagery rescripting, for instance, helps trauma survivors reimagine a past event in a way that restores agency and reduces distress. By confronting the image in a safe context and reshaping it, the emotional charge diminishes. Relaxation and grounding exercises complement cognitive restructuring. Progressive muscle relaxation teaches clients to tense and release muscle groups, reducing physical tension linked to stress. Breathing techniques, like diaphragmatic breathing, slow down the body's stress response and create space for calmer thinking. Grounding exercises, such as naming 5 things you see, 4 things you feel, 3 things you hear, 2 things you smell, and 1 thing you taste, anchor clients in the present moment during overwhelming emotions. Journaling extends CBT beyond therapy sessions. Writing about thoughts and feelings creates distance and allows patterns to emerge. Some journals focus on gratitude, others on triggers, others on evidence for and against thoughts. Over time, journals become a record of growth, showing how distorted beliefs gradually weaken. Activity monitoring is another technique. Clients track what they do throughout the day and rate their mood before and after each activity. Patterns emerge, perhaps mood improves after exercise or connecting with friends, but worsens after scrolling on social media late at night. Recognizing these links empowers people to make intentional choices that support mental health. Exposure exercises are crucial for anxiety and phobias. The process begins with creating a fear hierarchy, ranking feared situations from least to most distressing. A person afraid of dogs might start by looking at pictures, then watching videos, then observing a dog from a distance, and eventually petting one. Each step is repeated until anxiety decreases. The goal is not to eliminate fear instantly, but to gradually rewire the brain's association between the stimulus and danger. CBT also incorporates problem-solving training. Many people experience stress because they feel overwhelmed by challenges. Structured problem-solving breaks issues into steps. Define the problem, brainstorm solutions, evaluate pros and cons, choose one, and implement it. Even if the chosen solution is imperfect, the act of problem-solving restores a sense of control and reduces helplessness. Assertiveness training is another integration point. Clients learn to express their needs and feelings directly, rather than through aggression or passive avoidance. Techniques include using I statements, rehearsing boundary setting, and practicing calm but firm communication. This reduces interpersonal stress and strengthens self-esteem for health anxiety. Therapists often encourage response prevention instead of repeatedly checking symptoms online. Clients set limits. I will not search for health symptoms more than once a day. They also conduct behavioral experiments, such as noticing whether symptoms change when not checked. This helps break the cycle of reassurance seeking that fuels anxiety. Anger management within CBT often involves identifying early warning signs, clenched fists, faster heartbeat, tension, and using coping strategies before anger escalates. Clients might practice timeouts, where they remove themselves from a heated situation to cool down before responding. They may also reframe assumptions that fuel anger, such as, they disrespected me on purpose, replacing them with balanced interpretations like, they may have been careless, not malicious. CBT skills are not only corrective but also preventive. By learning to spot distortions and regulate behavior, individuals build resilience against future stress. This is especially important in relapse prevention for depression. Clients identify early warning signs of relapse, such as withdrawing from friends or increased negative self-talk, and create an action plan to respond early, re-engaging in activities, reaching out for support, or reviewing thought records. Mindfulness-based CBT expands the toolbox further. Clients practice observing thoughts as mental events rather than truths. This prevents over-engagement with negative thoughts and fosters acceptance. Instead of wrestling with every thought, clients learn to let them come and go like passing clouds. Combining mindfulness with CBT creates flexibility. Sometimes challenge the thought, other times simply observe it without judgment. Technology enhances integration. Apps can prompt users to record thoughts, guide them through relaxation exercises, or send reminders for scheduled activities. Online CBT programs provide structured modules, making therapy more accessible. While these tools don't replace human connection, they extend support between sessions. Family members can also be included in CBT. Educating loved ones about thought patterns and behavioral cycles fosters understanding and reduces conflict. Involving family creates accountability and support for practicing skills at home. Couples therapy uses CBT principles to improve communication, reduce assumptions, and build problem-solving skills together. Schools increasingly use CBT-based interventions for students. Programs teach children to identify unhelpful thoughts, regulate emotions, and practice problem-solving. These skills build resilience and can reduce the risk of developing more severe mental health issues later. Teaching CBT early equips the next generation with lifelong tools for coping. Workplaces also benefit from CBT-based training. Stress management workshops often include cognitive restructuring, relaxation exercises, and communication skills. Employees learn to reframe challenges, manage time more effectively, and set boundaries. This reduces burnout and improves overall productivity. The adaptability of CBT is one of its greatest strengths. Whether applied individually, in groups, or through digital platforms, its core principles remain consistent. Identify unhelpful thoughts, test them, and replace them with balanced alternatives, while modifying behavior to break harmful cycles. A metaphor often used in CBT is the snowball effect. A small negative thought can grow into a huge emotional avalanche if left unchecked. By intervening early, challenging the thought before it gathers momentum, we prevent the avalanche. On the flip side, positive actions can snowball too. One small success builds confidence, leading to more actions, more positive thoughts, and greater resilience. Clients sometimes resist CBT homework, thinking it feels artificial. Therapists often emphasize that it's like practicing an instrument. At first, playing scales feels tedious, but with time, it leads to beautiful music. Similarly, practicing thought records or relaxation exercises may feel awkward initially, but eventually, they become natural skills that enrich daily life. The evidence base supporting CBT's practical exercises is vast. Clinical trials show that behavioral activation is as effective as medication for many cases of depression. Exposure therapy is the most effective treatment for phobias. CBT for insomnia often outperforms sleeping pills in the long term. The consistent success of these exercises explains why CBT remains the gold standard in mental health treatment. Ultimately, daily integration is what transforms CBT from theory into transformation. Practicing thought records builds mental clarity. Scheduling activities restores engagement with life. Exposure therapy dismantles fear. Relaxation techniques calm the body. Assertiveness training strengthens relationships. Problem solving reduces stress. Mindfulness loosens the grip of negative thoughts. Together, these skills form a toolkit for navigating life's challenges with greater resilience and balance. Cognitive behavioral therapy across conditions and lifespan. Cognitive behavioral therapy has proven effective across an astonishing range of conditions, which speaks to the universality of its principles. At its heart, the framework of identifying thoughts, emotions, and behaviors, then altering patterns that perpetuate distress, applies whether someone is facing anxiety, depression, trauma, or even physical health challenges. Exploring these different contexts reveals the flexibility of CBT and highlights why it has become the most researched and widely practiced form of psychotherapy for depression. CBT often begins with breaking cycles of withdrawal. Clients learn to notice how staying in bed, avoiding friends, or neglecting responsibilities reinforces hopelessness. Behavioral activation encourages small, structured activities that counteract this withdrawal. Alongside, cognitive restructuring helps challenge hopeless thoughts like, "I'll never get better." Evidence often shows fluctuations in mood, periods of progress, or support systems that contradict the belief of permanence. Over time, the depression loop weakens as the client becomes more active and realistic in thinking. For generalized anxiety disorder, CBT targets the constant stream of what-if worries. Clients may keep worry logs, noting each fear and its eventual outcome. Frequently, worries either do not materialize or turn out far less catastrophic than imagined. Reviewing this evidence weakens the brain's conviction that worrying prevents disaster. Cognitive restructuring also addresses intolerance of uncertainty, the belief that one must be absolutely certain before acting. Through practice, clients learn that uncertainty is tolerable, and life can be lived without endless worry. In panic disorder, CBT combines psychoeducation with exposure. Clients learn that panic symptoms like racing heart or dizziness are uncomfortable, but not life-threatening. Interoceptive exposure deliberately recreates these sensations, teaching that they can be tolerated. Catastrophic thoughts such as "I'm having a heart attack" are replaced with balanced ones like "this is panic, and it will pass." Gradual exposure to feared places, supermarkets, trains, crowded rooms further breaks the avoidance cycle. For social anxiety, CBT addresses core fears of embarrassment or rejection. Automatic thoughts like "everyone is judging me" are challenged with evidence. In most social interactions, people are focused on themselves rather than scrutinizing others. Behavioral experiments include intentionally making small mistakes, such as dropping a pen in public, to test whether catastrophic judgments occur. Exposure to feared situations, coupled with restructuring, reduces avoidance and builds confidence. Obsessive-compulsive disorder responds well to exposure and response prevention, a specialized form of CBT. Clients face feared triggers, touching a doorknob, leaving the stove unchecked while resisting the urge to perform rituals. Anxiety spikes at first, but gradually decreases, proving that rituals are unnecessary for safety. Cognitive work addresses inflated responsibility, magical thinking, or overestimation of threat, replacing them with more accurate appraisals. Post-traumatic stress disorder requires careful adaptation of CBT. Trauma memories often intrude uncontrollably, and avoidance of reminders maintains distress. Trauma-focused CBT combines exposure to memories with cognitive restructuring of distorted beliefs such as "it was my fault" or "I am never safe." Clients learn to process memories without being overwhelmed and to replace self-blame with accurate understanding. Over time, flashbacks and hypervigilance diminish, and life becomes livable again. CBT for eating disorders focuses on distorted beliefs about body shape, weight, and self-worth. Clients track thoughts like "if I eat this, I'll lose control," and test them against experience. Behavioral experiments may involve eating feared foods in a controlled way to disconfirm catastrophic expectations. Restructuring challenges perfectionism and all-or-nothing thinking around diet. For binge eating, CBT emphasizes identifying triggers, interrupting urges, and developing healthier coping strategies. Insomnia treatment, CBTI, is one of the best validated applications. Clients learn stimulus control techniques using the bed only for sleep and intimacy, leaving the bed when awake too long, and establishing consistent sleep schedules. Cognitive techniques target beliefs like "I'll be ruined tomorrow without sleep," reframing them into more balanced views. Relaxation and sleep restriction methods recalibrate circadian rhythms. Studies show CBTI outperforms medication for long-term improvement. Chronic pain management also benefits from CBT. Pain is not only of physical sensation, but also influenced by thoughts and emotions. Catastrophizing, such as "this pain will destroy my life," amplifies suffering. CBT helps clients reframe pain-related thoughts, engage in paced activity, and use relaxation to reduce tension. While CBT does not eliminate pain, it decreases disability and improves quality of life. Substance use disorders involve powerful behavioral and cognitive loops. CBT identifies trigger situations, emotions, or thoughts that prompt cravings. Clients develop coping strategies, such as distraction, alternative activities, or challenging thoughts like "I can't handle stress without alcohol." Relapse prevention plans anticipate high-risk situations and rehearse healthier responses. By strengthening alternative coping, CBT supports recovery. For children and adolescents, CBT is adapted with age-appropriate language and activities. Young clients may use cartoons or stories to illustrate thought-feeling behavior links. Games, role-play, and art exercises make abstract concepts tangible. Teaching children to challenge scary thoughts early builds resilience. Parents are often included, learning how to reinforce skills at home and model balanced thinking. In older adults, CBT may address unique concerns such as grief, health problems, or isolation. Techniques remain similar, but therapists focus on age-specific themes, adjusting to retirement, coping with illness, or finding meaning later in life. Evidence shows CBT is effective across the lifespan, reinforcing its adaptability. Cultural context shapes CBT delivery. Therapists adapt examples and metaphors to align with cultural values. In collectivist cultures, emphasis may shift toward family harmony and social roles, while in individualistic cultures, autonomy and self-expression may be prioritized. Despite these adjustments, the core principle, challenging distorted thoughts and modifying behavior, remains universal. Group formats also demonstrate CBT's flexibility. In group therapy, members practice skills together, share experiences, and hold each other accountable. Observing others challenge distorted thoughts normalizes the process and inspires hope. Group CBT is effective for social anxiety, depression, and anger management, among others. Digital CBT programs extend access worldwide. Structured online modules guide users through exercises, thought records, and behavioral experiments. While less personalized than face-to-face therapy, digital CBT provides effective support, especially for those with limited access to therapists. Research confirms its effectiveness, particularly when combined with occasional human guidance. Schools implement CBT-based programs to address student stress, bullying, and emotional regulation. Teaching children to identify unhelpful thoughts and practice coping strategies equips them with tools for academic and social success. Preventive programs reduce rates of depression and anxiety in adolescents. Workplaces benefit from CBT-informed stress management training. Employees learn cognitive restructuring to handle pressure, relaxation exercises to reduce tension, and communication skills to resolve conflicts. By applying CBT in professional settings, organizations see improvements in employee well-being and productivity. One of the most fascinating areas is mindfulness-based cognitive therapy, developed for preventing depression relapse. Instead of challenging every thought, clients practice observing thoughts non-judgmentally. The skill of noticing thoughts as passing events prevents rumination from spiraling into full episodes of depression. Studies show mindfulness-based CBT significantly reduces relapse rates. Acceptance and commitment therapy, or ACT, is another evolution of CBT. Instead of changing thoughts, ACT emphasizes accepting them while committing to values-driven behavior. Clients learn that they don't need to eliminate negative thoughts to live meaningfully. This shift broadens CBT's reach, especially for chronic or treatment-resistant conditions. Schema therapy extends CBT further by addressing deep-rooted core beliefs developed in childhood. Clients identify maladaptive schemas such as abandonment, mistrust, or defectiveness and learn to reframe them while practicing healthier patterns. Though more intensive, schema therapy offers hope for individuals with long-standing difficulties. Across all these adaptations, the essence remains the same. Thoughts, emotions, and behaviors form cycles. Breaking those cycles through awareness, testing, reframing, and action creates change. CBT provides a roadmap, but the journey is unique for each person, shaped by their history, culture, and goals. The unifying message across conditions and contexts is empowerment. Depression whispers, "You're helpless." Anxiety shouts, "You're in danger." Trauma insists, "You're broken." CBT replies, "These are thoughts, not facts. They can be examined, challenged, and replaced. You can act differently, and through action, feel differently." That promise is why CBT resonates across the human spectrum. The long-term impact of CBT and how to sustain change. Cognitive behavioral therapy equips people with tools, but the true power lies in carrying those tools forward long after therapy ends. The question becomes not just how do I feel better now, but how do I maintain progress for years to come? Sustaining change requires ongoing practice, relapse prevention, integration into daily routines, and a commitment to lifelong learning. Relapse prevention is one of the cornerstones of CBT's long-term strategy. Many conditions, particularly depression and anxiety, have recurrent patterns. Clients are encouraged to identify their personal warning signs: changes in sleep, withdrawal from social connections, increases in negative self-talk, or loss of interest in activities. Recognizing these early signals allows for quick intervention before a full relapse develops. A personal action plan might include resuming thought records, scheduling pleasurable activities, reaching out to a therapist, or reconnecting with supportive friends. Homework during therapy prepares clients for independence afterward. Just as practicing scales builds a musician's skill, practicing thought restructuring builds mental flexibility. Clients are reminded that lapses are natural. The key distinction is between lapse and relapse. A lapse is a temporary slip into old patterns. Relapse is surrendering entirely to them. Learning to treat lapses as opportunities for learning rather than failures sustains motivation. Daily integration is vital. CBT skills cannot remain confined to therapy sessions or crisis moments. They work best when woven into ordinary life. Thought monitoring becomes a casual habit, like checking one's posture or noticing hunger. Behavioral activation evolves into intentionally balancing responsibilities with enjoyable activities. Problem solving becomes the default approach to challenges, rather than avoidance or rumination. Over time, these practices create a healthier baseline, reducing vulnerability to distress. CBT's emphasis on self-awareness transforms into a form of self-leadership. Individuals learn to guide their inner dialogue, question their assumptions, and make choices aligned with long-term goals. This autonomy fosters resilience in unpredictable circumstances. Stressful events still occur: job loss, illness, conflict, but the person no longer feels powerless. They possess a toolkit to respond constructively. A powerful metaphor for sustaining CBT skills is physical fitness. Attending therapy is like hiring a personal trainer. It accelerates progress, introduces proper techniques, and creates accountability. But lasting fitness depends on continuing to exercise independently. Similarly, CBT gives initial structure, but lasting mental health depends on practicing skills regularly. Even brief daily exercises, a quick thought check, a gratitude note, a grounding breath maintain strength. Social support reinforces long-term change. Sharing CBT concepts with friends or family invites accountability. For example, a partner can gently challenge distortions. Is there evidence that everyone hates you? Or is this the anxiety talking? Parents can encourage children to use coping strategies, making CBT a shared language within the family. Support groups, whether in person or online, provide ongoing encouragement and normalize struggles. Technology also plays a role in sustaining change. Apps offer reminders for mindfulness practice, digital thought records, or mood tracking. Online forums connect individuals practicing CBT skills, providing peer support long after formal therapy ends. Wearable devices even track physiological signals like heart rate, prompting users to pause and apply relaxation techniques when stress rises. Sustaining change also means continuing to set goals. When therapy ends, progress should not plateau. People are encouraged to pursue personal growth, developing new hobbies, strengthening relationships, advancing careers, or deepening spiritual practices. CBT provides the mental clarity and confidence to set and achieve goals without being paralyzed by fear or distorted thinking. Growth itself becomes a protective factor against relapse. Mindfulness-based practices enhance long-term resilience. While traditional CBT emphasizes challenging thoughts, mindfulness teaches acceptance. Combining the two creates flexibility. Some thoughts are best questioned, others best observed without judgment. This balance prevents over-reliance on any single strategy and adapts to shifting life circumstances. Self-compassion sustains motivation. Without it, people risk turning CBT into another avenue for self-criticism. I should be better at challenging my thoughts. I failed because I had a bad day. Practicing kindness toward oneself reframes lapses as part of the human condition. Research shows that self-compassion reduces shame and increases persistence, making it a powerful ally for long-term change. The ripple effects of CBT extend beyond symptom relief. People often report improved relationships as they communicate more effectively and challenge assumptions about others. Work performance improves because stress management and problem-solving skills enhance productivity. Physical health benefits too. Lower stress reduces blood pressure, improves sleep, and strengthens immune function. CBT does not just heal the mind. It supports overall well-being across the lifespan. CBT skills evolve with changing needs. Young adults may use them to navigate career uncertainty. Parents apply them to manage stress and model resilience for children. Older adults use them to cope with loss, health challenges, and transitions. The universality of CBT lies in its adaptability to different stages of life, always rooted in the same principle. Thoughts, emotions, and behaviors form cycles that can be reshaped. Research supports CBT's enduring impact. Follow-up studies show that many clients maintain improvements years after therapy ends, especially when they continue practicing skills. Mindfulness-based CBT reduces relapse rates for depression. CBT for insomnia sustains benefits long after treatment, outperforming medication. The durability of CBT stands out compared to interventions that provide temporary relief but little long-term change. Future directions for CBT are promising. Advances in neuroscience deepen understanding of how cognitive restructuring rewires the brain. Digital platforms expand access globally, bringing structured programs to underserved populations. Virtual reality enhances exposure therapy by simulating feared scenarios safely. Artificial intelligence may one day personalize CBT exercises based on real-time data, tailoring interventions to each individual's patterns. Yet the heart of CBT will always remain simple. Observe your thoughts, test their validity, act intentionally, and repeat. This cycle, practiced consistently, transforms suffering into resilience. It does not promise a life free of hardship, but it equips people to face hardship with clarity, courage, and compassion. Ultimately, the legacy of CBT is empowerment. People leave therapy not dependent on a therapist, but equipped with lifelong tools. They discover that while they cannot control every event, they can shape their response. They realize that thoughts are not dictators but hypotheses, that emotions are signals not sentences, and that behaviors are choices open to revision. This sense of agency is profoundly liberating. When viewed through this lens, CBT is more than a therapy, it is a philosophy of living. It teaches that reality is shaped not only by events but by interpretations. It shows that growth is possible at any age, that setbacks are not endpoints, and that resilience can be cultivated deliberately. It offers hope not as a vague feeling, but as a structured practice for those willing to engage with its methods. CBT becomes a lifelong companion, a guide through storms, a compass in uncertainty, and a reminder that change, though difficult, is always possible.